these are our objectives. We want to talk about the main infusion therapies. We want to talk about mechanism of action and indications. I used my book on infusion therapy as a resource for everything I'll present, so I wanted to make sure I give credit to the authors of the book as well. So first we'll talk about lidocaine infusion therapy, which is probably the most popular therapy we use for treating chronic pain conditions. The mechanism of action of lidocaine is, again, there are many mechanisms of action, but mainly it is a sodium channel blocker, but it has also anti-inflammatory effects, and it has been shown to decrease the granulocyte adhesion, migration, and activation. So the common mechanism of action is being a sodium channel blocker, but the more we study about it, we find other mechanisms of action that we can rely on for its mechanism.